But Dr. Coley, when COVID first started, we were telling people, reschedule those preventive appointments. It's not important to get that right now, but we're in this for the long haul right now. It's kind of a marathon, not a sprint. So why is it important to get those preventive screenings right now to know our baseline of health? And then what else should we all be doing to be the healthiest versions of ourselves?
So it is really important now because, as you pointed out, this is not a mode we're in now just for a few weeks as we were back in March. This is going to be us for the next several months, if not 1 or 2 years, until the vaccine is really widely available. So we have to start thinking about prevention again, because the next wave of morbidity and mortality from this pandemic, from people who don't directly catch the coronavirus, is going to be those people who don't get their preventive screenings, those people who don't, we aren't able to pick up diabetes or heart disease or thyroid dysfunction or what have you. So it is really important to start shifting our mindset a little bit about prevention and focusing on that again. And that's the reason 9Health and Quest have really partnered to try to make this a safe and completely enjoyable experience for you, where you can start to think about your preventive health again as we switch into this maintenance mode of kind of living alongside the virus, because it's not going away anytime soon. And your second question, Stephanie, was
just what else should we all be doing to be the healthiest versions of ourselves?
It is difficult during a pandemic to really focus on prevention, to get enough exercise, to get enough sleep, to keep our stress levels low. But all those things that we've talked about when there's not a pandemic still apply right now. So it is really important to maintain a healthy weight, to make sure that you're watching, the carbohydrate intake in your diet, the fat intake in your diet, to get those blood screenings, to make sure your cholesterol level, your sugar levels, your thyroid, your triglycerides, your vitamin D, all of those are where they need to be. And to really try to approach this in a holistic sense and ask yourself, what would I do to be my best self if there wasn't a pandemic going on? And those are all the things you still have to be doing. And then on top of that, some more, as Dr. Becker pointed out, washing your hands and wearing those masks. And so it's almost like, we're hyper aware of our health right now. And I really think this is a good time for us to start thinking about prevention in a more global and comprehensive sense, because this pandemic has made us realize that prevention is so important. If we could prevent these infections, if we could have prevented this virus from, coming into our society, that could really have changed the course of things. So in a way, it's really taught us a lot of good lessons about, how to move forward and how to think about our health moving forward.